Hello, I'm Dr. Heather Johnson. Today we're going to talk about women and heart disease. So heart disease is a very broad term representing various conditions. So for example, it can represent a heart attack, heart failure, abnormal heart rhythms. You may have heard of atrial fibrillation, or even valve diseases. And so heart disease is still the #1 cause of death for both men and women. When we talk about risk factors for heart disease, we're talking about contributors to heart disease. So there is overlap between men and women. For example, high blood pressure, high cholesterol, family history, smoking. Those are all risk factors for heart disease for both men and women. However, there are some risk factors that are very unique to women. For example, pregnancy-related conditions. They can increase a woman's risk for heart disease even about 10 years after delivery. We also realize that there are certain medical conditions that are more common in women, such as lupus, certain rheumatologic conditions. Those can increase risk as far as heart disease in women. There are certain heart-related symptoms that can definitely overlap between men and women. However, there are certain heart-related symptoms that are more common in women, such as fatigue, nausea, dizziness, excess sweating. Research still shows that women are sometimes less likely to receive a diagnosis of heart disease or to have heart-related tests when presenting with symptoms compared to men. Unfortunately, there's an increase in rate of heart attacks and stroke in women less than 60 years old going on right now in the United States. That highlights the importance of us addressing heart risk factors. And so it's important that women across all age groups, race, and ethnicities receive the medication they need. Lifestyle changes are still critical. For example, appropriate exercise as guided by your medical team, also quitting smoking, heart-healthy dietary and food choices are still part of the treatment plan. Unfortunately, delays in the diagnosis, delays in imaging related to heart disease can lead to complications. And so we want to make sure that women and men get a timely diagnosis and timely treatment of heart disease.